agreed to.
Mr Speaker.
Honourable Ruth Dyson.
Mr Speaker, I'm very pleased to stand in support of the third reading of the New Zealand Public Health and Disability Amendment Bill. I want to begin by commending the way in which the Select Committee has considered the matters during the previous deliberations on this bill. The Select Committee has three parties represented: the National Party, the Green Party and Labour, and on many issues we have worked, I think, in an exemplary fashion. We should actually be given a gold star by the Clerk of the House and probably the Speaker for the way in which we intelligently and seriously consider submissions. It is to the benefit of legislation that that's able to happen in the Select Committee process, Mr Speaker. I also want to commend the officials who assisted us with this bill. There were some political tensions in both major parts of this bill, and the advisers actually took those issues very seriously, particularly given that the concerns raised by both the Green Party and the Labour Party were backed up by an overwhelming majority of the 13 submitters. I think the advisers were really helpful in that regard, and I also want to acknowledge the submitters themselves. Mr Speaker, there was no disagreement on the two primary purposes of the bill. The first one, to establish a Health, Quality and Safety Commission. My recollection is that every single submitter who commented on the establishment of the Commission supported it. The second primary purpose was to give a mandate for collective purchasing across DHBs, for arbitration when DHBs had any conflicts or disputes over shared services, and the Minister requiring DHBs to plan in unison. So a much more centralised directive from the Minister in regard to purchasing and planning between the DHBs. And once again, Mr Speaker, every submitter said that this was an important step forward. The DHBs had made considerable progress in this regard voluntarily, but if there was one who was not happy to be part of that united picture, then it really held progress up. So having clear legislative backup for that desire is a good thing. So those are both good aims, and Labour supports the intent of the legislation. As I said, Mr Speaker, there were concerns raised about both of the primary purposes. The first, in relation to the Health, Quality and Safety Commission, I guess I could sum up by saying that submitters and Green and Labour felt that the commercial model just wasn't a suitable model for the Commission. That was the funding model that was in the original legislation. It no longer is in the legislation, Mr Speaker, and I want to pay a huge tribute to my colleague Kevin Haig from the Green Party for his tenacity in not only having his supplementary order paper submitted during the committee stages of the House, but also his ability in persuading every other party in this House to support it, because Kevin Haig's supplementary order paper was passed unanimously, Mr Speaker, and I think that was an excellent move. I'm sure that he'll be speaking to it more, but it's not a very common occurrence that a member from a smaller party gets a quite significant change to a funding model in legislation, as this was clearly a different ideology than the Minister had intended, and it got unanimous support from this Parliament last week. So I want to just acknowledge Kevin Haig's work and congratulate him on that. Mr Speaker, the Minister commented in the earlier stages of this bill that the primary purpose of it, not in terms of the specificity, but the overall aim, was to ensure that we had better planning for a more efficient health system, that we would reduce waste and deliver better services. Who could argue with that, Mr Speaker? My concern is that it's just frankly not true, and it's not going to deliver what the Minister sets out, because we've heard a lot of this stuff before from the National Government. We've heard a lot about delivering more frontline services, and what we have had is about 110 cuts to frontline services in the last 23 months. So well over 100 cuts to frontline services, when the Minister's promise was to improve frontline services. So how do those two statements and then the opposite in facts have a relationship with each other? Well, the answer is they don't. We also have heard on numerous occasions the Minister saying that we're going to cut down on bureaucracy. That's part of getting more of these services to the front line. But we've not only seen frontline services cut, we've seen an increase in bureaucracy. We have a huge new bureaucracy in Wellington called the National Health Board. They have really undermined the Ministry of Health, even though they're technically a unit of the Ministry of Health. The National Health Board is calling the shots. We know that the Minister has appointed people who favour his ideology rather than independent public service advice. And we know that the people running the Health Board and the people who used to be employees of the Ministry of Health, who are now consultants to the National Health Board, are costing us huge amounts of money. We know that Murray Horn was getting $1,500 a day to prepare a report which was basically laughed at by the health sector as being a massive leap backwards. So, Mr Speaker, when it comes to saving money and decreasing bureaucracy, let alone getting more services to the front line where people in New Zealand badly need them, this Minister gets none out of three. He has failed miserably on all three accounts, and it's very obvious from increasing public concerns about cuts to frontline health services now that people are getting very annoyed about that. That it isn't what they voted for, it isn't what the Minister promised, it's exactly the opposite. I raised in question time today, Mr Speaker, my concern about an entire service that is being exited from Capital and Coast Health. The Minister didn't seem to be aware of it, actually. He started talking about Capital and Coast Health being now in the same league as every other DHB, but actually that's not true. What the Capital and Coast District Health Board have said is that people who are just getting home support in terms of laundry, meal preparation or house cleaning, if they're getting no personal support at all, then their home support will be cut from their assessment, which will be rolling out from the 1st of December. Mr Speaker, that is exactly what we have seen in Otago and Southland, and members of Parliament from that region will tell this House that it has been an absolute nightmare for them in terms of elderly people coming to them with deeply distressing stories of their unfair treatment at the hands of the Minister of Health. People who are only getting 1 or 2 hours of home support a week, $30 worth, but that tiny bit of help makes the difference for that person between them being able to stay happy and well and safe in their own home or having to go reluctantly into a rest home, which would cost the taxpayer around $1,000 a week. So while the intent of this legislation is good in theory, what we have been waiting for 2 long years is some responsibility from that government and some delivery of their promises. We are frankly sick of seeing the opposite of what their promises were before the election. We've seen no reduction in bureaucracy. We have seen hundreds of frontline services cut. We have seen nurses, community health workers, social workers, mental health support team, their jobs gone. We have seen home support cut. We have seen over 100 other frontline health services cut at the same time as the Minister is saying we're bringing this bill in so we can be more efficient and deliver more frontline health services. Well, the question that remains, and it certainly was not answered by the Minister when he read that dreadful speech just prior to me taking the call, Mr Speaker, the question that remains is how will this move be judged? And there is nothing at all in this legislation which holds the Minister accountable for the promises he made. We've heard those promises before. We saw cash registers in public hospitals in the 1990s. We are seeing a creeping move to privatisation by stealth in our health system now, and we are seeing cuts to frontline health services. Mr Speaker, those are the concerns that submitters on this legislation made.